I just graduated from Purdue University in biomedical engineering, and that's where I got interested in healthcare systems.
I'm from Virginia Beach, so what can I say? I love the East Coast, clearly haven't really left. And I go to school at Virginia Tech, go Hokies.
So a little about me, I come from San Jose State, that's in Northern California by San Francisco, because people get confused. I actually work for our Industrial and Systems Engineering department. I help out with our senior design course.
So one of the reasons I'm passionate for healthcare is because of Dr. Paul Farmer, a physician anthropologist, and this is one of his ideas, that some lives matter less. The fact that some lives matter less is the root of all that's wrong with the world, and that's something that's driven me in healthcare.
We've launched an infinite number of projects. There's actually 26 new projects in 17 systems across 5 states. That's huge.
Not only I learn more, I also want to know more now about the healthcare systems, not only in the US, but in Switzerland and France and Ethiopia and all those countries I've lived in.
I really came in here wanting to know what I wanted to do for grad school, and I think I sort of did that, so hopefully.
It was sort of all teach, all learn, which is really my view of what an institute is. An institute does its mission, and our mission is to try to be a catalyst to help improve healthcare. But it's also a learning environment, and I learn every day, and I think that's what an institute should be.
Also, just as people, we're all coming from different backgrounds, and it was a really great way. And as a biology student, it was definitely a very different experience, and I'm happy that I'm going into engineering, and I think that everyone should kind of maybe step outside and not just be an engineer, that having more to your background is really great.
One thing that I learned when I first got here was that, and I will never forget, is that each year between 44,000 and 98,000 people die as a result of preventable medical errors. I think that's just, it's unbelievable, it's crazy, it's sad at the same time, and so whenever I come here, it's it kind of motivates me, and I'm like, okay, I'm not working here just to, minimize cost. I'm trying to save lives, so it's actually, it's a good way to motivate me whenever I come here.
I also learned healthcare systems have more issues than I had ever thought. I knew healthcare systems engineering was a field, and now I see why it's up and coming, because there are so many problems. And not everything will work the first time, which can be very frustrating, but that's why we have PDSA cycles.
What I loved about HSY was all the mentoring, especially the graduate students and the engineers and so on that I was able to meet. They've been fantastic mentors, the interdisciplinary teams, the healthcare professionals, and of course all the friends I made. It's fantastic. Hopefully we can stay in touch over the years to come.
The integration of education, application, and research is totally possible. I find it powerful, and I think it's fun. Everybody was involved in all of that. So you don't have to just do one and not the other.
Boston is wicked cool, lots of photos. We had a great time.